علينا كل مؤتمر باذن الله بخير. هنبتدي ان شاء الله دلوقتي البيدياتريك سيشن. معانا الدكتوره مروه محمد، مدرس مساعد اشعه عندنا في طب عين شمس، هتقول لنا موضوع الاي اي ان pediatric radiology how can it help.
Assalamu alaikum. Good morning, everyone. Our talk will be about AI in pediatrics. How can it help? Artificial intelligence, AI, has received widespread and growing interest in healthcare as a method to save time, cost, and improve efficiencies. The children are not young adults. There are intrinsically challenging aspects surrounding the practice of pediatric radiology. If long duration of imaging, it will need sedation or general anesthesia. Consideration for radiation exposure if ionizing radiation is being used. Need to obtain images of optimum quality. So, AI solutions could and should be used to enhance the workflow of pediatric radiology. Aspects used in, first thing, clinical decision support, CDS. Clinical decision support, CDS, implementing an AI-enhanced CDS tool could allow for rapid synthesis of all patient information held within electronic health records, EHR, matched against national referral guidelines, provide clinicians the most appropriate next course of action. Image acquisition. Decrease imaging acquisition time, decrease radiation dose, improve the image quality, and decrease the IV contrast dose. First, MRI scanning and image quality. Need to decrease motion artifact by training a neural network to learn relationships between zero-field K-space and fully sampled K-space for particular study type, allowing for interpolation of missing data in the future unseen studies. Second, CT image quality and radiation reduction. Reconstructing high-quality images from reduced amounts of raw data by teaching an AI model the typical appearance of low-dose CT artifacts and then subtracting these from other low-dose CT images could enhance image quality without increasing radiation dose. Third one, IV contrast usage. Deep learning techniques have been reported to help produce high-quality post-contrast MRI images in cases where only a fraction of a usual dose of gadolinium-based contrast agent has been administered. C. Quantification. As volume measurement of pneumothorax, volume of CSF and brain tissue in hydrocephalus, scoliosis angles from spine radiographs, and measurements of limb lengths on limb radiographs. Volume measurement of pneumothorax. The amount of pneumothorax is calculated as the radiolucent area between the lung parenchyma and the chest wall on simple chest images, and as the radiolucent volume within the pleural cavity on CT chest. Volume of CSF and brain tissue in hydrocephalus. AI diagnosis model can diagnose hydrocephalus by analyzing the factors of the shape and volume of ventricles, event index, and age. Measurements of limb lengths on limb radiographs. As this paper, deep learning measurement of leg length discrepancy in children based on radiographs. Measurement of scoliosis angles from spine radiographs. Automatic approach called minimum bounding rectangle MBR method to obtain the upper and lower borders of the vertebrae to measure Cope's angle. Also, segmentation of whole spine. Predictive modeling. Predictive modeling, AI technique have been commonly used to prognosticate clinical outcome and determine treatment regimen. AI models help in detection size, location, morphology, and the presence of edema in brain tumors, and accordingly expecting whether it's low or high grade. Image interpretation. As bone age, fracture, and in-chest X-ray. Bone age. AI systems yield results comparable to traditional manual bone age assessment, offering the metrics of objectivity, efficiency, and time saving. Bone fractures. AI is an effective tool for fracture detection that has potential to aid clinicians in busy emergency department. Chest X-ray, whether it's normal, other opacities, reticular nodular opacity, and bronchial thickening, bronchitis, bronchiolitis, bronchopneumonia, other diseases as in the heart, and pneumonia. Segmentation. Segmentation involves the identification, localization, and isolation of predefined structures within the medical images to identify tumors, organs, or other structures for image processing and interpretation. As this image, fused PET-CT images show automated multi-organ segmentation using publicly available UNet deep learning model, including segmentation of brain in yellow, bones in pink, lungs in red, trachea heart in blue, aorta in green, liver in orange, and spleen in purple. Reporting. Ensure images most likely to have a significant abnormalities are flagged up on the reporting work list and reported by radiologists first. To summarize, the current climate represents an opportunity for early adopters to better determine how AI solutions could and should be used to enhance the workflow of the pediatric radiology, potentially providing a more individualized patient and referral-centered approach. As patient presentation and referrals, examination booking, image acquisition, post-processing, quantitative analysis, interpretation, and reporting. Finally, the integration of AI technology facilitates informed clinical decision-making processes, thereby promising advancements such as quicker and more accurate diagnosis, personalized treatment plans, and reduced healthcare costs. Thank you.
Thank you so much, Dr. Marwa, for this nice talk. I'm very happy to be in this session about AI, and Shams University is leading in AI implementation and technology. أنا بس اللي مش عارفني أنا ياسين أستاذ أشعة ومديرة مركز ذكاء اصطناعي في الجامعة. بس أحب أعمل announcement صغير إن كل السوفت ويرز اللي اتكلمت عليهم الدكتورة مروة موجودين في ورك شوبس عندنا ورك شوب في تشست اكس راي بكره، عندنا ورك شوب فور تشست سي تي، عندنا ورك شوب فور برين بيقيس الفوليوم اوف ذا برين تيشو، واكشولي السوفت وير بتاع البرين موجود في الام ار في التخصصي جهاز سيمنز. وعندنا النهارده ورك شوب في مالتيبل سوفت ويرز في كل الابلكيشنز، واللي محتاجينه منهم وات ايفر يو وانت ممكن هيبقى موجود في الجامعه في خلال السنتين الجايين، ويا ريت نسجل عليه رسائل ونشتغل ونبتدي نimplement ان ورك، ما تبقاش بس سوفت ويرز موجوده على الماشينز. انا حبيت بس يعني اقول ان كل الحاجات دي موجوده في الورك شوبس معانا في المؤتمر، وهتبقى موجوده في الاسم الفتره الجايه ان شاء الله. Thank you so much for this session with this opportunity. حد عنده سؤال مروة؟ Our next speaker is Dr. Isra El Amin.